I started my experience in minimal invasive in 2003. So it's now more than 13 years that I'm doing routinely minimal invasive in my practice, either for isolated aortic, isolated mitral, and combined procedure, valve surgery and aortic surgery, and even coronary surgery through a minimal invasive access. Sternotomy is performed very rarely in my routine practice now.
So, what is the outcome of the minimally invasive surgery in your hospital, such as the modalities or something?
The benefit of minimal invasive surgery is not only related to mortality, which can be very low in isolated valve surgery, like for mitral repair, mortality is less than 0.5%. I recently published experience of around 1,600 mitral valve surgery, even combined procedure, even in high-risk patients with a global mortality is 1.1%. And in isolated aortic valve surgery, mortality can even be lower than 1%. So the advantages in terms of hospital mortality are very good, but benefit can be in many other clinical, usually outcomes, like bleeding and transfusion rates, like ventilation time, like long-term outcomes, survival in long-term, quality of repair, durability of repair are all equivalent to standard sternotomies, conventional surgery. So minimal invasive is surely not inferior to conventional surgery. For many aspects is superior, not only cosmesis, not only hospital stay, but even high acceptance by the patient.
Oh, yes. And so what are the challenges to do the minimally invasive heart valve surgery?
Are not too much, but surely you need to have some technical issues like a good scope, good video assistance. You need to have good instruments or dedicated instruments. But what you need is surely not only your skill, but even the skill of your staff, of your nurses, of your perfusionist and your anesthetist too. So it's not a single-man show, it's a staff work that can give you all these good clinical outcomes.
You have a cooperation between
all the people working with you.
Yes, and we know that to choose the right patient to do the minimal invasive surgery is very important. So what are the indications for such surgery?
Any patient who needs a valve surgery and any patient who needs even a aortic procedure on a root on the ascending aorta can be a good candidate for a minimal invasive procedure. Let's say that the only contraindication are combined procedure in which you need multi-vessel coronary surgery and multi-valve surgery. But you can even have an hybrid option in which you treat the valve disease and if coronary disease is suitable for PCI, you can do a hybrid procedure in which you can reduce the impact on the patient too, and even reduce the risk of the procedure. That's another good option.
Yeah. So, comparing to the traditional open heart surgery, what are the advantages and disadvantages of the minimal invasive heart surgery?
So the clinical benefits are a lot. You have a reduced surgical trauma, you have a reduced bleeding, reduced need of transfusion, and there is a correlation between transfusion and mortality. You have a less risk of infection. You have a shorter ventilation time, you have a shorter ICU time, a shorter hospital stay, you have a higher cosmesis acceptance, and even a lower pain. And all these aspects even lead to a lower cost of the procedure. So the advantages are really a lot.
Oh, yes. And then our last question is that during your speech yesterday, you also mentioned about the training program. And then in today's speech, Professor Aiden, he also said that the learning curve is a very big issue. So could you talking about the learning curve and the training program?
Learning curve is an important issue. Learning curve can be reduced with good teacher, and obviously expert should be the teacher who are morally obliged to share their knowledge, and there are many ways to share the experience, either by meeting, by hands-on meeting, by traveling and proctoring educational programs. These are the most conventional way to share the experience. But very important is, in my opinion, the role that telementoring can give in future. So technology can really help us in a cheap way with internet, give us the possibility to be simultaneously in the same day in 3-4 different ORs at different jet lag times, so that we can really promote and support surgeons in adopting innovation. And obviously what we need, and this is even an important role of the society, that all the educational aspects are, let's say, managed by the scientific society, so that each surgeon can be even certified by the society. And this is something that has to be politically accepted by the society. Another thing what is very important is the adoption of Husum curve analysis, in which we can observe the performance of the institution and of the single surgeon. And for doing this, we need to have standardized and good database, good data manager in our practice that can tell us how we are performing.
Yeah, thank you. Thank you for the interview. That's
Thank
all.
you.
Thank you.